Good morning, Facebook. Dr. Maurer here with Family Back and Neck Care Center, and today we are going to be talking about whiplash and the effects of whiplash and how it can be treated properly in a chiropractic office and with chiropractic care. So whiplash most commonly is received when a car accident happens, the car is struck from behind, or another car collides with an object, and the head suddenly is jerked back and forth beyond its normal limits of the muscle and ligaments supporting the structures of the head and spine, and they can be stretched or torn. We talked about disc issues a couple weeks ago, and the intervertebral discs between the bones can bulge, tear, rupture. The vertebrae oftentimes are forced out of their normal position, and this in turn will create a reduction in normal range of motion. So a lot of times people are in a minor car accident and they think they might have a slight headache or a little bit of pain afterwards, but they don't think much of it because the accident in their mind was not severe. So even though the car may receive very little damage, the occupants of the car can suffer serious spinal injuries, including whiplash. So car accidents are not the only way to receive whiplash. Collisions that occur during sporting events, slips and falls, numerous other things, they can all have the same damaging effect on your neck and on your spine. And these type of collision-related injuries are what we refer to oftentimes as whiplash. So what we look for is instability of the spine, other soft tissue damage that contribute to the headaches, dizziness, blurred vision, pain across the shoulders, into the arms and hands, reduced range of motion, which is the ability to turn the head side to side. These can all cause problems way down to the low back, and because your body's attempting to adapt to this new environment. Sometimes these don't even appear until weeks or months later, but one of the most common things that we see during an acceleration-deceleration injury, which is exactly what whiplash is the head snaps back and snaps forward, and the curve of the neck loses its normal shape. So if we look at an x-ray from the side, it should look like a banana. Excuse me. But oftentimes, because of the injury that was sustained to the neck, the curve actually reduces. So once the curve is lost in the neck, the body rarely will recover from that on its own. And this is where a chiropractor comes into play, because we can actually retrain the neck, provide you with proper exercises and strengthening and stretching and other modalities that we use in the office in order to build a curve back into the neck that has been lost due to whiplash. So we find this through the use of x-ray, orthopedic exams, neurological exams, and other basic tools that allow us to really see the effects of the whiplash injury on the structure of the neck. So the chiropractic approach to these types of injuries is to use specific and safe chiropractic adjustments to help normalize spinal function. And obviously we're going to go through a very comprehensive and thorough case history examinations to make sure that our recommendations as far as number of visits that are required in order to properly restore motion and position to the spinal joints and the spinal bones. If caught early enough, this information can be reduced and scar tissue can be minimized. So if you or a loved one has been in a car accident, give our office a call, okay? Because some of these jarring actions of the neck and other spinal joints can be very severe, even if they feel very minor. So call our office at 889-2225, set up an appointment, and we'll get you scheduled to check on the whiplash injury, the extent of injury, and if we need to do anything chiropractically to get you back to 100%. So signing off for today. Hope you guys are having a good Wednesday, and we'll be back Monday with another video. Comment down below if you want us to touch on anything in particular. We'll see you next week.